So, let's talk about radiofrequency neurotomy, sometimes called radiofrequency ablation. That's what it looks like. There are a number of needles through the skin focused on the medial branch nerves. So let's have a look at that in a little more detail. This is a treatment for facet joint pain. So what is radiofrequency neurotomy? Well, effectively what it is the application of heat through the end of a needle once the needle is placed in the appropriate location. You can see on the left-hand side there are a number of different needles, sometimes big needles, thin needles, long needles, short needles, and sometimes the needle tip has got a certain consistency or a certain sometimes the needle tip has got a certain consistency, sometimes it's got a certain anatomical variation or some kind of variation of the needle tip, and that allows you to provide different treatments. The needle tip is connected to a radiofrequency machine that we can control, and the radiofrequency machine is connected to the needle via a probe that is connected into the machine and then into the needle. And as you can see from the front of that radiofrequency machine, there are locations for 4 probes. We can focus treatment on 4 needles at a time. And that makes sense, doesn't it? Because to desensitize one facet joint, you need 2 needles because you have 2 medial branches that you need to focus on. And of course, sometimes there's more than one facet joint to treat at a time. So have a look now. You can see there are different types of needles, and the different types of needles allow us to focus different types of treatments in different parts of the body on different nerves. This is the minutiae that for us as pain specialists or doing these procedures, it is very important, and this absolutely allows us to provide the best treatments for some of the people we treat. So have a look there. That needle is straight, it's got a sharp tip. That needle is bent, it's got a sharp tip. That needle is bent, it's got a blunt tip. These different needles have different properties, and these different properties allow us to provide different treatments or different radiofrequency treatments. In the middle you can see these tiny little prongs that have popped out of the needle, and as you can see, if there's a certain prong and you apply heat to that area, it gives you a slightly bigger, what we call lesion, a bigger treatment, which means if we put this treatment next to a nerve or the needle next to a nerve and we apply heat to the needle, the heat is transferred onto the nerve. If you apply a bigger area of heat, you're more likely to get a better outcome, a better effect. Again, the minutiae here, but I just wanted to give you a sense of how we go about providing treatments. And as you can see, just focus on the diagram in the middle. As you can see, the needles are on a piece of flesh, perhaps a piece of chicken or something. And when you apply heat to the end of the needle, you can see this white area around the needle, so we can measure the area of lesion, which allows us to give the best outcomes for some of these treatments. This is the technical details that we as pain specialists can sometimes go into. And as you can see from the diagram on the top, there are different types of needles. So a fatter needle gives you a better lesion than a thinner needle. A longer needle gives you a better lesion than a shorter needle. That's a short fat needle you can see over there, gives you a certain lesion that we can measure. And of course you can see at different temperatures you can get different lesions as well. Now sometimes we talk about monopolar radiofrequency, which is at the top. And you can see that's just using a single pole, a single needle. Sometimes we choose to use bipolar radiofrequency, where we put 2 needles next to each other. We connect the needle tips electrically, and then we provide the current, or we pass the current between the needle tips. And that, you can see, provides quite a big lesion. So in some cases, we might choose to use a bipolar radiofrequency paradigm, as we call it.